A heart attack doesn't always begin when heart muscle starts dying. Sometimes it begins much earlier, with a warning, a brief opportunity, a final chance for intervention before permanent damage occurs. The frightening part? Many patients ignore that warning because the pain eventually goes away. The chest pain settles. The patient feels better. Life continues as normal. But beneath that temporary relief, a coronary artery may be moving closer and closer to complete blockage. And that warning signal has a name: unstable angina, a condition that every healthcare student must understand because it often represents the critical bridge between chronic coronary artery disease and an acute myocardial infarction. The patient's something that instantly gets everyone's attention. Doctor, the pain is different this time. Not because it is the worst pain they've ever felt. Not because it lasted for hours, but because it broke the rules. The chest pain that used to come only during exercise is now happening at rest. The discomfort that usually disappeared quickly is lasting longer. The warning signs are changing. And when chest pain starts changing its behavior, clinicians become concerned about one condition above all others: unstable angina. To understand unstable angina, we first need to understand what is happening inside the coronary arteries. Most cases begin with atherosclerosis, a process where fatty plaques gradually accumulate within the walls of coronary vessels. For a long time, these plaques may cause little or no symptoms. Blood continues to flow, and the heart continues to receive oxygen. But then something changes. A plaque becomes unstable and ruptures. The moment this rupture occurs, the body reacts as though an injury has happened. Platelets rush to the site. Clotting mechanisms become activated. A thrombus begins to form over the damaged plaque. Now pay close attention here because this is the key event. The clot only partially blocks the artery. Blood can still pass through, but not in sufficient amounts. As a result, the myocardium receives less oxygen than it needs. This lack of oxygen is called myocardial ischemia, and ischemia is what produces the chest pain. Unlike stable angina, where symptoms are usually predictable and triggered by physical exertion, unstable angina is unpredictable. The pain can occur during rest. It can wake a patient from sleep. It can appear more frequently, become more intense, or last much longer than previous episodes. Patients often describe a squeezing, crushing, pressure-like, or heavy sensation in the chest. The discomfort may spread to the neck, jaw, shoulder, back, or left arm. Some individuals may also experience shortness of breath, sweating, nausea, dizziness, or unusual fatigue. Now, this is where many students become confused. Although the heart muscle is ischemic, it has not yet suffered significant irreversible damage. In other words, myocardial necrosis has not occurred. Because heart muscle cells have not died, cardiac biomarkers such as troponin remain normal. This is one of the major features that separates unstable angina from myocardial infarction. However, that does not make unstable angina safe. In fact, it is considered a medical emergency because the partially blocked artery can become completely blocked at any moment. If that happens, blood flow may stop entirely, leading to myocardial infarction and permanent heart muscle damage. That is why early recognition and treatment are so important. Management aims to improve coronary blood flow, reduce myocardial oxygen demand, prevent further clot formation, and stop progression to a heart attack. If this explanation is helping you truly understand the disease process instead of memorizing isolated facts, save this video now and share it with a fellow student. These are the concepts that strengthen both examination performance and clinical reasoning. So let's bring everything together. Unstable angina occurs when an atherosclerotic plaque ruptures and triggers partial thrombus formation within a coronary artery. The resulting reduction in blood flow causes myocardial ischemia without myocardial necrosis. The chest pain becomes unpredictable, often occurs at rest, and signals a high risk of progression to myocardial infarction. If you missed our previous lesson on stable angina, watch that video next, because it lays the foundation for understanding why unstable angina is far more dangerous. And after that, continue with acute myocardial infarction, where we'll explore what happens when coronary blood flow becomes completely obstructed and heart muscle cells begin to die. Until then, keep learning, keep connecting concepts, and keep building the clinical reasoning skills that transform information into medical understanding.